Good afternoon. My name is Maria Argudo, and welcome to my remote collaboration and evidence-based care video for Nursing 4030, Making Evidence-Based Decisions. In this assessment video, I plan to propose an evidence-based practice plan to improve the safety and outcomes for a pediatric patient with cystic fibrosis. I would explain the ways in which an evidence-based practice model was used to help develop the care plan, as well as reflect on which evidence was most relevant and useful when making decisions regarding the care plan, and identify benefits and strategies to mitigate the challenges of interdisciplinary collaboration to plan care within the context of a remote team. In this assessment scenario, we have a pediatric patient named Caitlin who has been hospitalized for her second diagnosis of pneumonia. She is at risk for ineffective airway clearance related to increased thick secretions, as evidenced by bronchi scattered in the upper lobes. Our desired outcomes for the care plan include educating parents on chest physical therapy, which is where, quote, a caregiver or partner can clap or vibrate the person's chest to further dislodge and move the mucus to the larger airways where it can be coughed or huffed out of the body. End quote, parentheses, Cystic Fibrosis Foundation, no date, end parentheses, period. The parents will be educated on administering nebulizers care at home. Nebulizers are, quote, medical devices that turn liquid medications into a mist, which you can then inhale, end quote, parentheses, Cystic Fibrosis Foundation, no date, parentheses, comma, period. It will help Caitlin breathe better, and once Caitlin is older enough, she will be taught cuffing and huffing, which is a technique that helps move mucus from the lungs, and it involves taking a deep breath in, holding it in, and actively inhaling, according to the Cystic Fibrosis Foundation no date. In order to achieve our desired outcomes, we will implement activities such as the nurses administering antibiotics while Caitlin is hospitalized in order to combat her pneumonia, and as well as educate Caitlin's parents on chest physical therapy, nebulizer treatments at home, and huff and coughing technique once she's older. The evidence-based practice model that was used to help develop Caitlin's care plan was the Stettler model of research utilization. According to Mercy Medical Center no date, quote, the Stettler model of research utilization applies research findings at the individual practitioner level. The model has 6 phases: 1. Preparation, 2. Validation, 3. Comparative evaluation, 4. Decision-making, 5. Translation and application, 6. Evaluation. Critical thinking and decision-making are emphasized in this model. This model has helped develop Caitlin's care plan by implementing preparation, validation, and evaluation mainly. The care team has prepared and validated educational materials in order to teach Caitlin's parents and will therefore evaluate their understanding of the educated material upon leaving the hospital. Additionally, evaluation would take place with follow-up care via remote collaboration through video call. The most relevant evidence is the Cystic Fibrosis Foundation website, which provided us with evidence-based treatments on cystic fibrosis. The evidence was factual, which helped with the development of Caitlin's care plan. In this scenario, in order to overcome the challenges with evaluating the care plan, the team has set up a social worker that will help Caitlin's parents to obtain resources in order to communicate remotely with the care team. Since cystic fibrosis is a chronic condition, the team has involved Caitlin's pediatrician as well, who will help Caitlin's parents by keeping them up to date on education and remote calls with the hospital care team. With the help of remote collaboration, Caitlin and her family are properly equipped with access to resources and professionals that would assist in Caitlin living a healthier life. Thank you.